Welcome to the City Current Show. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference and powering the good. And we're honored to kick it off with Anthony Fox. He's the president and CEO of the Tennessee Mental Health Consumers Association. How are you doing, Anthony?
I'm doing well. What about you?
Doing good. So let's start with some background. Give us a little bit of history for the Tennessee Mental Health Consumers Association.
We've been in existence since 1988, so we're in our going on 34th year coming up. We started out small, just providing education and some advocacy efforts in the state of Tennessee, and we've really grown over the years. We are the only statewide organization that is owned and operated by people in active recovery from mental health conditions or addiction, and what that means is we've all encountered the treatment system. We've all received treatment. So it makes us a very unique mental health provider. We have several roles in the state. We're a provider of care services for a select group of people that qualify. And we have several other programs that are just geared to serve the community the best way that we know how. Our company, we're not really clinical at all. We're more of a support type service. We try to complement all the clinical care, and a lot of people come to us for care outside of their clinical needs. So our care program is a day program. People can come as much as they like, once a week, once a month, 3 times a week. They can come as much as they choose, what's helpful for them. And then we have several other programs that are designed to specifically provide one-on-one care to people that have been in hospitals, that are leaving hospitals or crisis units. And then we do education and advocacy work through contracts with the state of Tennessee, just to raise awareness, train people to use this practice that we use, train people to use our practices in their everyday jobs. So we have several contracts with the state that we provide there. We also provide employment services. We provide employment services in 7 counties in mid-eastern Tennessee, and we also have just picked up Murray County in Middle Tennessee. We also have a peer support center that is a little different program. It's for people that are uninsured, uninsurable. They can participate in the program without any means to pay. They can just come participate. It's a grant program as well. It's located in Memphis, Tennessee.
Talk about what, in terms of the power, what makes you different? Like you said, the fact that it's peer-to-peer, it's kind of owned and operated by those who understand mental health, in collaboration, obviously with the provider side, but talk about kind of what makes you unique and very different, where that power lies, if you will, of being different.
Yeah, well, when I participate in state and federal type meetings, I work with a lot of behavioral health specialists, behavioral health CEOs, state and federal government agency staff. And then there's groups like ours. We're not the only one, but we're the largest in Tennessee and one of the largest in the nation. We bring what we call lived experience to the table. Lived experience has been, I provide services, our staff provides services in a hospital now, and some of the hospitals that we are providing service to, staff have also been a patient in a hospital. So we kind of see the system from the inside out, and then we also see it from the outside in. We're able to use our lived experience as a tool to bring awareness, to encourage and inspire hope, and just really use our life stories to help people.
How has the pandemic impacted your efforts? I look at it as the pandemic has really opened the conversation for mental health in a big way and the importance of it, but how has it impacted your organization?
Initially we had to move really quickly because we were seeing people in person every day. When the pandemic first, hit, and we were really unsure what it was going to bring. We had to move to a more virtual platform really quick. So we just our management team we just gathered and we tried to determine ways to move forward. We set up a system of telephone. We used FaceTime or Zoom or Microsoft Teams or any type of way we could reach people to stay connected with them. It's really improved the way we can provide care now, because we were providing face-to-face care, which is, in our business, the programs that we serve folks, face-to-face is best. But it also gave us an advantage that was sort of pushed upon us or pressed upon us because we didn't have any other choice. So we really increased our visibility with people using virtual tools.
When you look at the programs, dive in a little bit deeper. You mentioned quite a few of them in the beginning, but dive in when you talk about PeerLink and some of the different peer center, some of the different programs. Give us an illustration of how that works, especially on the peer-to-peer side.
Okay, well, PeerLink is our recovery services. That's our daily program. It was developed. We developed a peer-based recovery program in effort to reduce crisis service needs. It's also a rehabilitation program where, I tell people all the time, when you're diagnosed with a mental health condition or a mental health issue, or you become a patient, you either sometimes you lose your identity and mental health becomes your identity. We try to help folks either regain the identity they had before they were sick, or we help them create a new identity. And just, I think it's real helpful, because when you have someone that is a peer in recovery and you can talk about your own life experience, you can help folks navigate the past and also navigate the future. That's kind of what we do with our PeerLink recovery services. We have another program that's called Peer Intensive Care Services. That program is designed we have staff that work in conjunction with all the regional mental health institutes owned by the state of Tennessee. And we also have staff that are involved with all the crisis stabilization units that are owned by other providers. This program, it provides a person opportunity to have a peer mentor for 90 days. So it's a very structured program. It's designed to connect people with following psychiatric hospitalization or being in crisis with appropriate community-based services, supports, and facilities that can meet the person's post-discharge needs. So that's a program where a peer falls with someone for 90 days, hopefully, or as long as they kind of need us. We have a really cool program. When I was talking about our employment program, it's individual placement and support. And what that does, it matches a peer in recovery. That's an employment specialist. It's a degree position. A person has to have a master's degree, but they also have to have recovery experience. In our agency, we match with people, and it's rapid employment search. So it's not sheltered workshop, it's rapid employment search. We ask the person what they want to do. We're helping them build that portfolio to gain employment. The Peer Center in Memphis, like I said earlier, it's just a place where people can come. It's more of a unstructured, it's fairly structured, but it's more unstructured place for people that have been diagnosed, that are trying to reestablish themselves, that can just come spend time with other peers. We provide 4 trainings for the state of Tennessee. We have our own recovery-based program called Bridges. It's Building Recovery and Individual Dreams and Goals Through Education Support. That's a mouthful, but it's a self-help program, and it's for people that have recovery histories. We also provide Wellness Recovery Action Plan. It's a plan that was designed that helps people who have mental illness take responsibility for their lives. It's a training program. We provide mental health first aid. It's kind of awareness of mental health, and it's targeted to the general public, police officers, clinicians, any other type of folks that might be interested. in the program. And then we have a training that's called Introduction to Peer Support. And what it is for people that are interested in maybe joining the peer workforce, or people that are just interested in, learning how to provide peer support for each other. And then, then there's public policy. We try to stay on top of public policy by following policy in Tennessee, but also following policy at a national level. Most of the public policy work is kind of do myself. That's kind of part of my job and my role, but we have partner agencies and folks that we team up with to really try to help ensure that Tennessee and federally, there's good policies for people that have mental health conditions and addictions, and we just want to make sure that folks are not. I mean, we keep an eye out for really good stuff. We also keep an eye out on some things that could negatively impact, our recovery model.
We'll talk about how the community can help. So how can we help your efforts?
We're always open to come and engaging with members of the community. What we really would like people to hear, or we would really just like people to hear from us, engage in some of our trainings. Let us talk about stigma associated with mental health. We don't get a lot of really good news around mental health. It's mostly always bad. And for every one bad thing that happens in the mental health world, there's millions of great ones that are happening at the same time. I think, the public we could engage with the public more. If anyone, would like for us to come out and speak or train their staff or have conversations, that's kind of really our long-time goal and mission, because we just really want people to know that we're not dangerous. People with mental health conditions and addictions are not dangerous. Mental health and addiction is not a character flaw. It's a disease. And we really just want to help people understand that mental health recovery is possible. And we have a lot of folks that are doing really good work and are living proof of that. So just engaging with us and having us, speak and come out and do trainings and those kind of things, I think would be the most productive way we could engage with the community.
We'll wrap up with contact information, website. Where do we go? So where do we go to learn more?
Yeah, our website it's kind of weird, but it's www.tmhca-tn.org. We don't have an official Facebook page. We have a Twitter. It's at TMHCA, like the initials in our name. My email is afox, just AFOX at tmhca-tn.org. My phone number is 615-835-2223. Those would be kind of the best ways to start an initial conversation.
Well, Anthony, I greatly appreciate all you and your team are doing. Thank you so much for coming on the show.
Thank you, Jeremy. I appreciate it.